for the typing. We're trying out a new format. Um, so I'm really excited to be here with Leah Porsche, Dr. Leah Porsche. She is a maternal and fetal medicine specialty for OBGYN. She's actually based at Eastern Virginia Medical Center in Norfolk, Virginia. And we've actually spoken with Leah before talking about PPE and kind of that right whenever the pandemic hit. We were noticing a lot of applications in the way that fashion has really shown up in unexpected spaces. And really, what we wanted to do with this talk was really twofold. One is to kind of remind us that we're really in a space of addressing cross-sector needs right now. Fashion as safety, fashion as compliance, fashion as health, but also just making sure that we're also staying vigilant. So our second goal was really just to kind of remind everyone that we're still very much in the midst of this pandemic. And although, has it been 5 or 6 months, 5 months since we've spoken in this context, we're still very much in this. And so the tendency of the community at large, the public, is really to kind of feel like, man, we've been doing this for some time now. And so we're really ready to move on to something else or to focus on something else. But the pandemic hasn't stopped focusing on us. So, so what we want to do is invite Leah back, Dr. Porsche back to speak with us, just to kind of share like, hey, how are things at the beginning of this process, personal protective equipment, kind of experiences in the field. And then we'll kind of talk a little bit more about what's kind of happened during the time that we've been away, and then kind of looking a bit more to the future. So Leah, welcome back. It's a pleasure to have you.
Thank you for having me. It's my pleasure to be here.
Wonderful. Well, we'd love to talk to you a little bit more about, whenever all of this got started, what was your experience like, working in the clinic, serving, the community? What was that like for you?
It was frightening actually. Because there were this is a novel virus, there's so much that we didn't know about it, and so quickly we were seeing how virulent or dangerous this virus was. Of course, there was a heightened emphasis on making sure that the healthcare providers themselves are protecting themselves, but also limiting the spread in the community. And so, personal protective equipment is designed to be a one-time use equipment. So you go into a patient's room, you do your interaction with that patient, and then you discard that equipment so that you're not spreading virus to other healthcare workers or your next patient. And every time you go into that patient's room, if it's 2 or 3 or 4 times that day, you use different disposable equipment. Now we were seeing that with the heightened need for that equipment, we were running out. So we didn't have enough of what we needed. And so then, of course, we had to have protocols to preserve equipment, and then we had to have protocols to reuse equipment. And the last time I was here, we talked about our protocols for reusing our N95 respirators, and how we had to kind of go through that. We are still, the amount of cases kind of fluctuate. Of course, there's regional differences for how many new cases there are, how many deaths per new cases. But what we have transitioned to now is instead of, so they can transition to, you turn in your N95 respirator, they developed ways to sanitize them, and then they would redistribute them. And that means that you may get a respirator that somebody else used, but it was sanitized. I'm not intimately familiar with the sanitation process and how they did it. But any mask that was not visibly soiled was to be turned in, to be reprocessed and reissued.
Wow.
So what some people have done was gone and bought their own personal reusable respirator that is N95 quality, so that they don't have to reuse someone else's mask.
Right.
But I think one of the main things that we've also seen is that many of the cases, and this is something that we knew before, but many of the cases of coronavirus are asymptomatic. So if you screen people, then you find that there are many people that have the virus or are capable of spreading the virus, but don't have any symptoms themselves. And one way that we know
Wow.
this is the case, or that I know this is the case from my experience, is all of our patients on our labor and delivery unit that have planned admissions are screened so that we know how to protect ourselves and other patients in that situation. Many of the patients come back positive without any symptoms at all. Our patients are allowed one visitor with them who is supposed to be masked the entire time they're in the hospital. But we don't test the partner, we just test our patient. And so we're not sure that that's an additional exposure that we're not as aware about. So it's kind of morphed throughout time. But I think one of the major things to consider is that it's not just a symptomatic patient that can have the virus and spread it. It's also people that don't exhibit any symptoms at all.
Wow. That's a huge, I feel like since this has been going on, we've learned so much about what this virus can do. And I think that we're not used to the idea of having no symptoms and yet spreading something so specifically. I think that we may feel a bit safer when we are like, okay, they're not coughing, they're fine, or they're not, they don't seem to have symptoms, or there's no fever, I'm fine. It's a bit difficult to even really understand how severe or concerning this virus actually is, outside of obviously seeing how many cases there are globally as well as what's in the US. I mean, Texas is really having a difficult time with our cases and deaths here in the state. And so, but I think a lot of it has to do with perceived risk. We kind of don't really understand that risk. So, in terms of like how you're seeing just kind of people interacting in like day-to-day life, in the community, wearing face coverings or not, what's been your experience there, kind of during this timeline, during this pandemic?
So it's variable. I think a lot of establishments have now required people to have face coverings for entry, or face coverings to be served in their establishment, which I think is very reasonable. And then I think that there's also maybe some misinformation about how you're supposed to use the face coverings. Yes, they can be uncomfortable, especially in the dead of summertime. They can be hot, but they don't protect you if you don't wear them appropriately. And I actually have my mask that I wore out today, but this is the mask that I use whenever I go out around town. I use the medical grade one whenever I'm working. But I often see people wearing the mask on their chin, and that's not protective.
No, it's not.
Or just covering your mouth. Just covering your mouth, that's also not protective. It does not work unless you have the mask covering your nose and your mouth at the same time. And so it's really important that if you're going to use a covering, it's essentially wasted if you don't use it the appropriate way.
Absolutely. And I think that's really key for people to understand. I think a lot of times our perception about how they're being used, or what's good enough, is, typically, based on comfort, or based on, duration, or, oh, well, I'm not 6 feet next to someone, so therefore I shouldn't really have to worry about it so much. I think sometimes I even have a hard time with this, kind of if you're like on a walk in the neighborhood and it's Texas, so it's hot, and so you want to make sure that you're, covered, but you're like, but how intense do I need to be about it if we're by ourselves in the morning, or if it's, a few people out on a walk in the afternoon, but then whenever you're in public enclosed places, I think that there's, it's easier to understand that I'm in closer proximity, but in your experience in terms of, best practices or what people should be doing, we're all working toward this together. What are you seeing that people should be doing?
So the current kind of risk assessment is that if you are within 6 feet of a person with coronavirus, whether they have symptoms or not, unmasked for 15 minutes, then you are at risk. So if you are within 6 feet of someone for 15 minutes without personal protective equipment, then you're at risk for contracting the virus. So if you have, if I walk into a patient's room and they had not been screened and I didn't have my equipment on, and then later we find that they had coronavirus, and this actually happened. I had my, except for I had my respirator and my eye protection and everything like that. We found out later that she was positive for coronavirus, and so I had to call. Actually, our human resources called me and said, "Hey, this patient that you came in contact with is positive. Were you wearing your equipment? Were you fully protected?" And because I was, I did not have to be tested and I didn't have to go on quarantine. But if I had gone into that space without the appropriate equipment, then I would have been out of work for 2 weeks.
Wow.
Even though she didn't have symptoms, she tested positive. And so it's really important that we are being careful. But yes, 15
Absolutely.
minutes, 6 feet without a protective equipment, that puts you at risk of coronavirus.
So that's really good information, because I've been hearing a lot of 6 feet, and unmasked, that's a problem, but I haven't really been hearing the time duration, which is also helpful. I think that a lot of times whenever we've been looking at this, it's really been focused primarily on, is it 6 feet, 6 feet, 6 feet, which I'm glad that we're all getting drilled on 6 feet and we're learning 6 feet. But if people are even within 6 feet and no mask for 15 minutes, we're still in a space of concern, right?
Correct.
Is what I'm hearing. And so even if, so that's what makes it challenging. You got the neighbors outside, everyone wants to play because everyone's tired of being cooped up in the house. But if you haven't been maintaining, your circle, or who you're quarantined with, I guess, then now you're kind of opening yourself up. So this is really important information. So I think some of the things to reiterate: proper mask wear, proper face covering wear, not wearing it on our chin, not wearing it, below our nose, covering your nose and your mouth together, right? Making sure that we're maintaining our social distance and, doing our, making sure that if we're not covering that 15 minutes really does make a difference. So the length of exposure makes a difference, even if someone doesn't have symptoms.
Correct. And one thing that I tell my patients in different scenarios is, people talk about, oh, I don't know if you're going to get into this, but which mask is the best mask? Is there a better mask?
Yeah, that's a good question, because that's really where our STEAM opportunity comes in, right? It's like, okay, do we need to build a better mousetrap for the virus, right? Where it's like, we don't want it we want to make sure to keep it away.
Right. So
tell us
what
more.
I tell people is, when it comes to birth control, the best birth control is the one that you will use, right? If you don't use it, it's not going to make a difference. The best prenatal vitamin is the one that you will actually take. It doesn't matter how much iron it has in it if you don't put it in your mouth. You know what I mean?
Okay. But yeah, you're right. Absolutely.
The best mask is the one that you will use consistently. And so I have some personal opinions about which ones I think are more tolerable. This was one, this is a double layer mask. It has a space for a filter if you choose to put one in. It's structured. It does not collapse on your face as you breathe.
Okay.
And so it does maintain a little bit of space on the inside. And it also has an adjustable nose strap. Okay, so comfort-wise, I feel like a structured fabric with adjustable nose strap that kind of does not collapse as you breathe is a lot more tolerable than the very flimsy face masks that kind of lay against your face. I think it really helps people to keep the mask on instead of pulling it down every time you talk or taking it off because you get hot. And I'm currently in my third trimester of pregnancy. Just talking makes me out of breath, and so being able to wear a mask that is not going to feel suffocating, but is still going to allow that filtration and that containment of respiratory droplets I think is really important. So I think the best mask is one that you can wear.
Absolutely.
And these are some features
Yes.
that I have found that that are very helpful in actually maintaining proper use.
That's great. I was actually at the doctor the other day, and I was observing. I had my face covering on. It was a cotton double layer mask that is actually downstairs in the kitchen right now. But I had my double layer cotton mask. But the nurse practitioner that I saw had her face shield and a double mask situation going on, and I literally saw perspiration on the other side of the surgical mask because of how long she'd been wearing it and having to speak to a patient. So literally it was like it had just completely been soaked, from heat and perspiration and talking and all those things. And I was glad that she had like her shield on, but I just, as people are going about their day, and they have to wear them for prolonged periods of time, is there even like a kind of I don't know, now I'm kind of wondering, is there a best practice in terms of like how long you should be wearing it, or do you just and then swap out, or do you guys get time to do that? Because when I observed that from her, she just, it seemed that, maybe she would go on another little bit of time before switching out for another surgical mask. But I wasn't sure if that had come up for you guys.
So, ideally, the ideal use of an N95 mask is that you put it on and that you don't touch it until you are done using it. Now,
Okay.
again, these are supposed to be one-time use, one patient use, short intervals. So they were not designed to be worn for 8 or 12 hours a day.
Right.
So to expect that is a little bit unrealistic because of the way that they were designed. They were designed to be protective. You're supposed to be able to walk in, see a patient, and then you remove it and discard it. But that's not how we're using it now.
Right.
So the double mask situation is that you put the N95 on, you put another surgical mask over it to prevent it from being soiled. So that if we're in surgery or something, you don't want fluids to get on it or whatever. And so it's not soiled. And then I have worn that face shield before. It is incredibly hot. It is stifling.
Okay.
And so I'm not surprised that she was sweating. And it's on your upper lip and that whole thing.
Right.
So I think that the difficulty is that we have limited resources. She probably had to use that one all day or all week. And that's just what we have. So ideally you don't want anything used to help whenever you're seeing a patient. But you also should not be touching your face at all.
Right.
And so it hopefully would not be an issue as far as transmission and contamination with patients. I would have something that is not going to be soiled and used.
Right. So this kind of brings me to my next question about kind of availability of resources, because you mentioned, it was only supposed to be used for one patient at a time, and that it's not designed to work for 8 to 12 hours a day. And so we're like, yes, that is like, but now we're in the space where you're having to like find ways to kind of wash your hands between patients, or or keep things like sanitary with like the face shield. But it's difficult for the provider to be able to utilize that. And so you're trying to find ways. This is kind of where I believe design steps in, right? It's like, what are the design solutions into creating something that works better? Or how do we provide more resources so that doctors aren't having to, utilize the same equipment all day long with every single patient? This is kind of taking us all the way back hundreds of years to where people were seeing patients with the same stuff, right? And this is not where we're so much more advanced in that.
What are germs?
Right. What are germs, and why do I have to wash my hands in between every patient? Miraculously, we found out, that, this is public health, right? And so public health is washing your hands. But it's also being able to properly switch out personal protective equipment between patients and reducing exposure for doctors having to go from patient to patient. And so, we've seen You look beautiful in your third trimester, carrying your little one, by the way. You're doing fantastic. But in terms of just, exposure, we're just concerned about everybody. We're like, how do we protect everyone involved? And from your experience, like in terms of the shortages, because that was like acutely on everyone's radar whenever this first started. Are we
Right.
still in a shortage situation in terms of availability of personal protective equipment for doctors, or are we kind of dealing with it with all the manufacturers kind of switching gears? Is it getting better?
My understanding is that it's getting better. I have not heard nearly as much about, hospitals running out completely.
Mm-hmm.
But I think that it's still, I mean, in an ideal situation, could be better because we are still reusing equipment, you know, and we have, protocols in place that have been deemed satisfactory um, to protect the physician who's reusing the equipment and also the adequate protection for the patient that you're seeing. Um,
Mm-hmm.
but I think in the ideal scenario, it would still be a one-time use scenario.
As
Um,
it's designed.
as it was originally designed, correct. I think the other difficulty is that since we are again going back to this asymptomatic spread, since we don't know, and not every person is screened, you can't screen everybody because we don't have resources for that either.
Yeah.
So we are using personal protective equipment for every single patient encounter instead of selecting. Because
Mm-hmm.
usually what you would do if a patient had tuberculosis, you would put this on and you would go in because you knew the patient had something that was at risk. Otherwise, you wouldn't be using it for every person. But I use it for every
Right.
single patient that I see every day that I'm at work. And so
Right.
I think that's
Because you
the
can't
other
know.
issue. You can't know. That's the other issue with it is that we're not using it the way that we had been using it before, which
Got
means
it.
that we're using it much more frequently. And I think that is really
Right.
truly what contributed to the shortage in the first place.
I see. That makes so much sense. So it's increased frequency just from a normal use intention,
Mm-hmm.
plus a shortage of equipment availability in general. So it's like if you're exacerbating it, you've got more cases. In addition to just the other reasons you'd be using it for tuberculosis and other reasons, like
Right,
we know
exactly. We
that,
start using it
but you're going to
for
use it
regular use.
regardless. Yeah, but it's
Yeah.
it's like a complete shift in the way that the equipment's being used. Um, so one of the things you said kind of made me concerned because I'm always not a fan of good enough. I was like, man, So it sounds like there's still a need, but that on some level the risk management, has been somewhat mitigated. It's improved,
Right.
but it looks like there's still an opportunity to continue to provide more resources to still protect our, healthcare workers more, but also protecting the general public more.
Yes. Yeah. Absolutely. And I honestly believe that if we did a better job of general masking in public and in elections, um,
Mm-hmm.
and keeping gatherings to the recommended number, small number. I think depending on your region, they have different recommendations about how many people should
Yeah.
be gathered in one place. Um,
Right.
and then having masks that are easy to wear for prolonged periods of time that are readily available to the general public. I think that's
Yes.
going to really cut down on the number of cases that we see and then
Mm-hmm.
the need for healthcare workers. So I think it kind of is all
Yes.
kind of interdigitated or intertwined in its cause and effect. Now, I
I
read
would
an
agree.
article just the other day about, I think there was a wedding that happened. I can't even remember where it was. Someone had a wedding and people gathered and it was noted to be like the hotbed of exponential spread. And
Right.
multiple people died as a result of that. It wasn't the people that were at the wedding, it was the people who got it as a result of the people being at the wedding. That
Wow.
named it. So I think a lot of times
Wow.
we don't understand what our personal impacts can be. And
Right.
we need to be aware that it's not just you getting sick or your person that you live with, but someone that
Right.
you shook hands with or pass on the street that then gives it to their elderly grandmother. or visit
Wow.
to their immunocompromised cousin, and those are the people
Right.
that are more affected by it. So
Wow.
just kind of the epidemiology can be so, it's easy
Yes.
to get tunnel vision, but it's really about
Mm-hmm.
the greater community, the greater population. And it's really
Right.
important that if we get masks that people can wear, that are comfortable, that are fashionable, that
Yes.
that they are going to use. If it doesn't work,
Right.
you don't use
Right.
it.
Right. So I want to highlight a few things. One, I wish I could kind of encapsulate that last 2 minutes and like replay that on repeat for anyone who'll listen. Weddings have been super spreader events. And sometimes, to your point, the super spreader, you're not even really aware of
Right.
the true impact if you think, oh, well, no one at the wedding got sick, but the people at the wedding could have spread it to others who did
Exactly.
and could have potentially. And so the way that we're all interconnected with this is so much deeper than just our own interaction and whether or not something happened to us or something happened
Exactly.
to our child. It's like, okay, but who else did you come in contact with that
Right.
wasn't as strong? Who else did you come in contact with who may have been susceptible? And our responsibility to ourselves and our community is so much higher than that. But I agree with you, like fashionable masks, masks that fit, the mask that you will wear is the right mask for you, right? So if you don't like it because it doesn't go with your outfit, then we need to find one that looks better for you, and we will design into that. If you
Yes.
need one that is uncomfortable, that's more comfortable to wear for a longer period of time, then we need to design into that and make them more comfortable and finding how to, I love that yours has the adjustable nose bridge and, kind of the structured face, so that you're not having to like deal with it touching and pulling in and out of your face. I
Right.
also want to make a quick note that in your space, I know that there's, kind of a limit of how many people can be where you are, and that there's a lot of places will have tables that are available and tables that are not available in order to
Mhm.
maintain distance. So
Exactly.
I just want to
Yep.
kind of mention that as well, as we're
Yes.
talking about this, that, that you're observing what's appropriate in your area. Our area actually
Absolutely.
just came from, we have like a 5-stage uh, scale of how vigilant the community is supposed to be, and we were at a 4 for the longest time. We recently moved to a 3 not too long ago, and so 3 kind of allows for a little bit more movement, if you will. But every stage has, you know a way for people to kind of engage safely. So
Right.
Virginia is not having the same experience that Texas is.
Yeah.
So I'm at home and you're enjoying a coffee shop. One day I'll be at a
One
coffee
day
shop.
you get to go.
Yeah, they have, people are going, but I'm just not ready yet. So,
Yeah. Yeah.
but eventually we'll get there. But yeah, so at any rate, I just wanted to make that note because I know that, we're talking about safety and that you're taking precautions that are appropriate for where you live, and we're
Yes.
taking precautions that are appropriate for where we live. So it may look different across the country,
Exactly.
what people are able to do. So,
Yes.
but Leah, I really appreciate your insights. I feel like even just as we're looking forward to what's, where this may be going, I still see that we have still some needs, here from, really cross sector solutions from
Yeah.
fashion and health and, manufacturing to create more products to keep people safe,
Right.
whether it's the community or healthcare.
Absolutely. And as flu season approaches, when
Flu
everybody has a
season.
runny nose and a fever,
Oh
it's
my
going to be really
goodness.
difficult to determine what's what. And I think that it's another reason to really be cautious about keeping yourself safe.
Yes, allergies are kind of having their way here.
Mhm.
They're kind of
Yeah.
getting cranked up. So I've had a few more sniffly noses, and I was just like, wait, it's just allergies, right?
Right.
And you're
Can I
not
still smell my
sure.
coffee? Can I still smell my coffee?
Right. Can I still smell my coffee? Very, very important things to kind of
Yes.
know, do I
Mhm.
have chills or do I have sore throat or,
Right.
um, so all of these things are really concerning for us. But I appreciate you being willing to have this conversation to kind of have it afresh, It's been several months, but we're still in this, and um, so we're looking forward to ways that the fashion industry can help support, product that works for people during this time. Shifting manufacturing to support this, as well as really looking for ways to support our healthcare workers that are on the front lines. So, thank you, thank you for
You're
joining me.
welcome. Thank you for having me.
And just as a quick note, I'll be doing another session on ACCFI Presents with our production coordinator, Michelle French, probably another few weeks or so. We're going to be talking about some face coverings that we actually sent off to Argonne National Laboratories for filtration testing. So we did a few different styles with different materials, and we'll be sharing some of those findings about which ones perform the best here shortly. But we really want to encourage you guys to, stay safe, stay covered, and observe, what's appropriate for your area. And Leah, thank you so much. Dr. Porsche, thank you for joining us. It's a pleasure to have you.
It was a pleasure to be here. Thank you so much for inviting me back.
Thank you for coming. So we will catch up with you guys next time for ACCFI Presents. My name is Nina Means. I'm the director for Austin Community College Fashion Incubator. And you can catch us on all of our social media at ACC Fashion Incubator on LinkedIn, Facebook, and Instagram. On Twitter, we are at ACC Fashion Incube, a little shorter for Twitter. And if you haven't checked out all the exciting programs we have coming up here at the Fashion Incubator, you can follow us or sign up for our email list at fashion.incubator@austincc.edu. All right, guys, thanks so much, and enjoy your weekend. Stay safe.